Let's talk about group therapy billing, but not billing CPT code 97150 for about $17 reimbursement. Instead, let's talk about individual codes that are billed during group sessions. And so Medicare has published, and this is my favorite resource, it's 11 Part B billing scenarios for group therapy. And what I'm going to do is I'm going to read from the screen. I'm not going to share my screen for this one, but then we'll talk about the different scenarios that I typically see in my clinic and why I love being able to deliver one-on-one codes in a group situation. So first, let me read. If you download the PDF, it's page 3 of 6. It's section A, one-on-one example. I'm just going to read it and then we'll come back and talk. So, quote, in a 45-minute period, a therapist works with 3 patients, patient A, B, and C, providing therapeutic exercise to each patient with direct one-on-one contact in the following sequence. Patient A receives 8 minutes. So if you're doing this, it has to be done in at least an 8-minute block of time. You can't just do 1 minute here, 1 minute there, and collectively add up the minutes. It has to be at least one solid 8-minute block. So back to this. Patient A receives 8 minutes, patient B receives 8 minutes, and patient C receives 8 minutes. So you're hitting all 3 patients one at a time, direct one-on-one therapeutic exercise for 8 minutes. After the initial 24-minute period, the therapist returns to work with patient A for 10 more minutes, totaling 18 minutes with patient A, then with patient B for 5 more minutes, and then totaling 13 minutes with patient B, and then finally going back to patient C for 6 additional minutes, totaling 14 minutes for patient C. During the times the patients are not receiving direct one-on-one contact with the therapist, they are each exercising independently. The therapist appropriately bills each patient one 15-minute unit of therapeutic exercise, CPT code 97110, corresponding to the time of the skilled intervention with each patient. So let's talk about that scenario. Let's talk about how that scenario could work for you in an outpatient clinic. And let's talk about why I love the ability to be able to deliver this to my Medicare beneficiaries. So first, my personal bias. My caseload. These are individuals that are typically coming to me for outpatient orthopedic conditions. It could be non-surgical, shoulder, hip, knee pain. It could be post-surgical, total knee replacement recovery, rotator cuff repair, any number of post-surgical referrals. But those are the 2 most popular that I see. So when I look at my community of patients, they've been coming to me on and off over 20 years worth of time. A lot of them are really seeking the engagement, not just with me, but with other patients in the clinic. They love the socialization that they get. They love the mental and cognitive stimulation that they get. They start to build relationships. They build friendships. And I live in a relatively small community. It's about 5,000 to 6,000 population. And so a lot of these individuals are neighbors. They know each other. Maybe they go to church with each other, or they work together. And so my therapy clinic gives them an opportunity to come in and see everybody and kind of connect in a way that's different than what they're used to. And so for me, let's say I book 3 patients in the 8 o'clock spot. So right now I have multiple patients that are coming 5 days a week. They're receiving a single unit treatment 5 days a week. Why? Because I think that's what's best for them. When I evaluated them, 2 of them are post-surgical total knee replacement referrals. 1 of them is a non-surgical left shoulder pain. I've got a couple other patients that sprinkle in and out of this kind of 8 o'clock cohort. But the idea is for me, they might be in my clinic 20, 30, 40 minutes. They're going to get 1 unit of direct one-on-one therapy. Now, it might be therapeutic exercise. It might be manual therapy. It might even be therapeutic activity. It just depends on what they need based on their plan of care, based on their progression toward their goals. But I think 15 minutes of dedicated time working on a very specific task or activity for that particular treatment is far more effective than trying to cover everything in 60 minutes or 90 minutes, which I know some therapists do 90-minute sessions. I think that 15 minutes, 5 days in a row is more effective than, say, 60 minutes 2 times a week or 1 time a week. I think that within the first 5 minutes of leaving my clinic. When a patient comes to me, they've forgotten 90% of what I've shared with them. And it makes no difference if they're there for an hour or they're there for 10 minutes. It really is one of those things. The other part that I look at, and this isn't the only reason, but this is an element in this, is when we're looking at operational efficiency. One of the most impactful events that happens in a clinic that loses that clinic money, I mean, it can wipe out an entire profit margin for a day, is when you have a patient scheduled and that patient cancels or no-shows and you're not able to rebook that session. Because if you have 10 patients scheduled, one of them cancel, you lose a massive part of the profitability for that day. You have the expenses, you already took care of everything, and now it's gone. So what I love about this opportunity is, let's say I book 3 patients at the 8 o'clock spot. Let's say one of those patients, it's 8 o'clock. So let's say they call in that morning, they wake up, they're just not feeling well, they don't want to come. That's fine. I've got 2 other patients that'll fill that spot and utilize those therapy minutes. Let's say I've got 2 patients that just can't do it. Something came up, their car broke down, their battery's dead, it won't start, whatever. I don't care. I've got a 3rd patient that will take that spot. So I've built redundancy into the system that allows me to recover any openings that would have otherwise gone unutilized. What if all 3 cancel? So 3 patients, open plan of care, they all cancel on a specific day. That's okay, because I've got a wellness program, a non-covered maintenance program that has other Medicare beneficiaries in the clinic that are not being billed for the time, but maybe on a maintenance program. And if the time works out where they're in the clinic anyway, and it's about time for me to do a covered maintenance visit for them, maybe to reassess progress, maybe to look at what they're doing, update their program, change something within the routine, I can turn what would have been a non-covered maintenance visit into a covered maintenance visit because they were already in the clinic. So if you ever see images, photos, videos in my clinic, you're almost always going to see 5, 6, 7, up to 10 patients in my clinic at any given time. But it's important that you realize that not all of those patients are being billed for. Some of them are being billed a single unit. Some of them are on a non-covered maintenance program with occasional covered maintenance visits in there. Some of them are doing this variation of a group program where they're getting a 1-unit direct care intervention, but then the rest of the time they're doing their program independently. So there are lots of ways to make this happen. And of course, I didn't even get a chance to talk about the benefits of eliminating MPPR when you're doing single unit sessions. So if you look at the math, I'm not going to do it right now, but look at the math. Give yourself 4 single unit sessions, compare the reimbursement, roughly $120 for a Medicare visit, 4 single unit sessions, compared to 1 4-unit session, which is coming in at about $98 reimbursement. That's about a $22, $23 increase in not just revenue, it's a massive increase in profitability. And so if you can deliver a better patient care experience, get better outcomes, improve compliance and retention, eliminate the negative impact of cancellations and no-shows, save Medicare money, you can do all of this with this kind of program. And Medicare lays it out beautifully for us to see exactly what they expect us to do.